There were really two very good studies about awareness of how a diagnosis is reached when children with either hypotonia or weakness present. And what was found was there's a high degree of variability in terms of the understanding and the thought process behind how diagnosis is reached. And that variability highlights the fact and was a topic of another poster where a practice guideline might actually be important very early on to help pediatricians and child neurologists arrive at the diagnosis of spinal muscular atrophy.
In 2018, QSMA released a survey to 300 general pediatricians to gauge their overall awareness of spinal muscular atrophy, while also assessing their approach to developmental screening and their approach in clinic should they observe hypotonia. This was important for us because one of QSMA's ongoing projects is via the QSMA Industry Collaborative is with the Education Topic Group, which is tasked with reduction of diagnostic delays in SMA. So SMA has many forms. Its most severe and common form, SMA type 1, it's a medical emergency in terms of early diagnosis. The reason why there is a sense of urgency with early diagnosis, especially with SMA type 1, is because symptom onset typically occurs prior to 6 months, but on average at 2.5 months, while diagnosis is delayed at 6 months or more. This period of delay also overlaps with a time frame in which there is a rapid loss of motor neurons. So to address this issue, the Industry Collaborative was looking to release an awareness campaign. So we wanted to get a sense of where pediatricians are at baseline. With the results of the study itself, we noticed a number of variances. For instance, with providers who self-reported a general understanding of what SMA looks like and how to diagnose it, there was an average of approximately 60% of individuals who said that they were either moderately to very aware with the diagnosis, but of that population, only 50% indicated that genetic testing is the requirement for diagnosis. So they're not as familiar as we would like them to be, at least. Also, when we asked about their utilization of developmental screening tools, there was some variance in that as well. Current guidelines suggest that all children should be screened at the 9, 18th, and 30-month well visit, and they should also be screened should parents voice concerns. So there are a variety of developmental screening tools that are readily accessible and available to all healthcare providers. Of the 300 pediatricians that we were able to survey, approximately 56% said that they went well above and beyond the current guidelines and were utilizing screening tools at every well visit. However, just 23% indicated that they were utilizing it minimally at the 9, 18, and 30-month well visit, but not during surveillance. And approximately 9% of providers are only utilizing screening tools during surveillance when the parents of the children are voicing concerns with the provider at the well visit itself. So because of that variance, we consider that to be a potential target for additional educational opportunities for pediatricians, since that developmental screening is crucial. So variance in utilization of screening tools does offer some acknowledgement in terms of where a potential gap could be occurring and something that could be a contributing factor to the developmental delays. With the survey, we also asked providers about their typical course of action should they observe hypotonia in an infant in clinic. 56% indicated that they were more likely to refer an infant to early intervention, while just above 50% indicated that they would utilize a referral to a neurologist, and 14% indicated that they would potentially watch and wait. Again, this offers some insight into where additional delays could be contributing to the delays in diagnosis.
What was also very unique was this online educational sort of an interactive tool that helped highlight those practice guidelines, whereby you could actually reach diagnosis for sort of an early diagnosis and referral process that helps with sort of push towards treatment for this devastating disease.
To address these knowledge gaps, Cure SMA has rolled out a campaign called Smart Moves, and it offers a variety of free on-demand resources for providers and parents alike to increase awareness regarding what SMA looks like early on. And it's also designed to empower both providers and parents to act quickly should they identify those early signs. So if a pediatrician or a parent identifies symptoms such as weakness or hypotonia in an infant, head lag, especially in type 1, or with a combination of dysphagia or a bell-shaped chest. These are signs of what SMA looks like with our type 1 population, and we urge them to promptly refer to a neurologist or a child neurologist for further evaluation. And the ordering of genetic testing so we can promptly diagnose and treat.